Okay, vamos a go over the process of discharge in a patient going to a nursing home. So I normally go to the orders for discharge. This is a test patient, so this is not going to show in real patient. So we go to discharge and discharge disposition goes to nursing home, and you modify the diet here. You can do control and pick different diets. We right click here also to modify. We can see we can click no restrictions, and actually you can clarify the time of a discharge. Here, so you can also you can modify here special instruction. You can order special instruction when bed okay. So once you have done that, we can just go for signature. In this case, I can't sign because this is a test patient, and this is actually discharge patient, so I can't do that. But normally you'll be able to sign this. And we go by provider view, go to discharge. Please make sure the diagnoses are correct in order of importance. If you want to add or take it out, you can do that. MedRec, we do the MedRec. Actually, in patient education, I would suggest not to add any educational material because it's going to be a lot of papers going to the nursing home. So, and this is not a hard stop, so you can proceed with the discharge without educational material. Follow up. I have a personal favorite for SNF physician. You can do that. And then I would recommend to go to patient instruction here. So what I have here is I have a dot phrase, for example, dot PT is physical therapy evaluation, dot OT, occupational therapy evaluation and treatment. You save it. Obviously, you have done the physical exam and hospital course. And then you go to discharge summary. You can put the time spent. I have a dot phrase for that time. And you can sign and submit. And actually you can, and for the discharge nursing home patients, we should do the discharge instructions. We should go there, and this normally doesn't appear because there's no discharge instruction. This one already had a discharge instruction. So in a brand new patient going to nursing home, you won't have this dialog box. So create new note. So the reason to do this is to actually have this document available for the case manager to print and fax to the nursing home. So this is actually the paper that is going to substitute the written transfers documents that we've been doing. So here supposed to have a diagnosis. As you can see, the discharge instructions appears here, and also diet wound care, everything that you have done in the order set should appear also here. It's important that the medication are up to date. Please, you have to um, clarify for how long. For example, the antibiotics, you should clarify when you do the medrec how long you have to continue that medication. So everything is done. As you can see, there's no educational materials. You sign, which as you can just sign it. You don't need to print. And the nurses can, or case manager can go to notes, discharge documentation, discharge instruction. This is the one we just did, and they can print and fax to nursing home. So if the patient doesn't go to nursing home that day, we can create another one in 1 or 2 days when the patient is ready, and we have to make sure that the medications are up to date. You make another document at that time, and the nurse, the case manager should fax the updated version of the discharge instructions. This process is similar in Palmdale, so once we do all this, we don't need to do the paper. Okay, this is it.